Hi, everybody. Welcome back to Anatomic Insights for Common Pain Problems. I'm Dr. Narda Robinson, osteopathic physician and veterinarian, and founder and CEO of Curacore Vet. So I welcome our Curacore Vet community from our Facebook channel and YouTube, as well as our graduates from Curacore programs from our private Facebook group, Veterinary Medicine Elevated. So we're going to talk about the biceps femoris today. Let's take a look at it and chat a bit about it. But before we do, remember, I am going to talk about human stuff and veterinary stuff, but this is for our graduate community and those interested in our courses, mainly in the veterinary professional realm. So if you find something that's relevant to you, consult your own physician. And if it's relevant for your animal, consult your own veterinarian. Okay, so the biceps femoris. Here we have a depiction in the dog. We're going to come back to that. But as a human physician first, what I really notice about this is that the biceps femoris, which is from here down, so down all the way down, is much more extensive than in the human. In the human, let's take a peek at that. This is the left human leg, and there's the foot with the little toes right there. And so this is the lateral aspect. So if that gives you some perspective. Here's the gluteus maximus. We're going to remove that. And hi, Ginger. Good to see you. Let's add you to the broadcast. There you are. Thank you for being here again. And everybody else. And remember, you can comment, you can ask questions, you can give feedback, and I will notice you along the way. So this is the back of our thigh for those of you that are human right here. And the big thing here is that we're noticing that the biceps femoris begins at the pelvis. So again, this is where the iliac crest would be. These are the gluteal regions. I took off the gluteus maximus. Do you know what this nerve is? That is the sciatic nerve. So it's your biggest nerve in your body. It is about the width of your thumb. So when that gets compressed by the little piriformis that would usually be here, that can create problems that commonly known as sciatica. So you would have radiating leg pain, you might have weakness, you might get misdiagnosed as having a disc problem and then get surgery, which you didn't need. So what we're going to do here is take off the biceps femoris, and I just want you to realize that it's attaching up here at the ischial tuberosity and then coming down and inserting on the fibula down here. So it's let me see, get you positioned again. It's pretty discreet here. And in Travell and Simon's book, the Trigger Point Bible, Trigger Point Manual, they have dubbed these hamstring muscles here, so semitendinosus, and then sneaking in there is the semimembranosus. They talk about these as being the chair seat victims. So when you're sitting in a chair all the time and you're just compressing this and you're depriving it of a certain amount of blood flow and compressing that sciatic nerve, which is right underneath and between, then that's not going to be happy. The blood flow that goes to the sciatic nerve isn't going to be great, and you're going to be potentially causing a neuropathy or just an unhappy nerve. So we can see why in the human who might sit in a chair that having squishing of the biceps femoris and the semimembranosus and semitendinosus isn't great. But you know, in my medical school career, yeah, I learned that the biceps femoris is coming from the ischial tuberosity and then inserting down on the limb. We do have two heads in our hamstrings and our biceps femoris. So there is a smaller head that attaches about midway down and then will commune and join with the long head of the biceps and the semitendinosus down here near the fibular head and the lateral collateral ligament. But that's about it. And so when there's dysfunction and shortening of the biceps femoris, we might get back of knee pain, we might get back of leg pain, we might have sort of a sciatic dysfunction, but it's not going to really compromise so many of our stabilizing elements and our hip, our sacrum, our hock or ankle, and so on, like we might see in the non-human. So if we take a look at a non-human and put the leg down, we can just look for comparison back at the dog. So now that we've seen the human, this would be the ischial tuberosity in the dog, and then it's coming down. But amazingly, to me, it started from the human. The attachments, why it's so big and friendly, this biceps femoris, is that in the dog, it not only attaches to the ischial tuberosity and the sacrotuberous ligament, but it also attaches to the lateral aspect. So this lateral aspect of the patellar ligament, it attaches to the tibial tuberosity, the cranial margin of the tibia. So you can sort of see when it's coming down here and it's just blending, this is all biceps femoris, which is much, much bigger than in the human. It's also attaching to just the general crural fascia in here, and the lateral calcaneal tract of that Achilles tendon or calcaneal tendon. And that is super huge in importance. Put this guy down. Let me show you how I depicted it on with some clay. And so I drew some sacrotuberous ligament right in there. And so that is attaching from like the last aspect of the sacrum and the first caudal vertebra down to the ischial tuberosity right there. So that's big in itself. That is new and different and not what we're seeing in the human, for whom the information about the biceps femoris is most known, you know. So we're still putting things together, and thank you, everybody, for just chiming in and all. So keep those comments coming and questions. So here we have the let's see, the main aspect of the biceps femoris. And so that's where we're seeing it attach from the ischial tuberosity down to the lateral aspect of the patellar tendon and down to the crural fascia and the cranial margin of the tibia. So just even stopping with that, what does that suggest? And let's think about a live dog and how things would manifest there. What's one of the most common things that we're taught to think about in the hind limb as veterinarians? Well, the crania cruciate. So if the dog is not weight bearing, then things that I want to expand on, but oftentimes what we're taught is, well, that must be a cranial cruciate ligament until proven otherwise. And then what we're taught, which I disagree with also, is that you would then refer for a TPLO or tibial plateau leveling osteotomy as a response. And I say, no, let's not do that anymore. Let's really fully examine the limb. Let's do a complete myofascial palpation evaluation throughout the whole dog, front too, and decide, okay, what is going on? What is it that that is tense? What is tender? What nerves might be entrapped? Why is the limb being elevated here? There are many reasons why also, even if it is localized to the stifle, why it might not be ligamentous damage, or even if it was, then how can we help that without having to cut through the tibial bone and decimate in some ways the pes anserinus, which will be our next video session, and and just plate it back and introduce all kinds of risks of infection, bone plate problems, left-in hardware, all kinds of things. And you can find my opinion on the web, things I've written. So anyway, so we would do a full exam, but one of the culprits of potentially an unstable stifle in the dog is going to be lack of hamstring firing. So hamstring, for a while I thought of boycotting the term because I thought it was talking about pigs, and I'm a vegan and just, whatever meat things, but actually it's not. It's an old reference that talks about the crook of the knee and tendons that are around there. So that's okay. But the hamstrings in review are going to be the biceps femoris laterally and the semimembranosus and semitendinosus medially. So biceps femoris, semimembranosus, and semitendinosus. So if the hamstrings, let's focus on the biceps femoris. If the biceps femoris is not firing, then what's going to happen? Well, with the anatomy of the biceps femoris, we're seeing that that's going to be coming here and going to that cranial margin of the tibia. What do you think that does? That is serving then as an agonist or a supporter of the cranial cruciate ligament. And so if we don't have adequate firing for one reason or another, let's say they're not using it because they're a city dog and all they do is they go down the elevator and they walk out onto the pavement, they do their business, and then they go up, or something like that. For whatever reason, if their hamstrings, especially the biceps femoris, is not strong, then the unifying features of that muscle that are coming from the sacrum, sacrotuberous ligament, the ischial tuberosity, the patella, the cranial border of the tibia, the crural fascia, and a branch coming to the lateral calcaneal tract. Somebody says they lost me. I think I'm not muted. So, well, come back. Nancy will run in and tell me if there's a problem. But anyway, so there's just so much to do to keep everything intact that we need to make sure in our palpation, in our rehab assessment, and so on, that things are working as they should so that we have good neuromotor control over joint integrity. And so when we come back and look at this guy, and I'll just talk about a comment again from Ginger. I thought it was a glute when I was in gross anatomy because of its size and attachment sweeping over like the gluteus maximus. I mean, isn't that the truth? Ain't it the truth? So yeah, just how different the glutes are in the human versus the dog. They're more little ones. Hard to get this all on the picture. I mean, they're big enough, but it's way different than the gluteus maximus with the humans that are supposed to be running across the field or marathon kinds of things, chasing things. But anyway, so you look at this, and it is so extensive. It is so big and friendly, coming again from the sacrum down to the knee, coming across the front of it and helping to keep this all intact. Isn't that what we want? Because when the cruciate is deficient, then what's going to happen? Well, the tibia can translate forward, and that's your cranial draw sign. But look what else is happening. Because there's a lateral, okay, it's working, still working well in India. Great. Thank you, Deepa. Appreciate all the input there. And, that's us telling you. Oh, anyway, yes. So still working here. Well, Deepa, I'll send healing vibes to the connection in India, but please always stay in touch like that. I appreciate that a whole bunch. Anyway, different from the human until proven otherwise with further anatomical input from studies and all that. We have this great lateral contribution to the calcaneal tract. What's that going to do? Well, just even in general, we are therefore, the big and friendly biceps femoris is unifying from the sacrum to the hock. How would that manifest if there was a problem? Well, one thing, we could maybe see destabilization of the hock, along with other things as well. And and maybe hip problems, maybe stifle problems, maybe incoordination. And if the biceps femoris is not countering the pull forward from the quads, so you have hypertonic quads and hypotonic biceps femoris, then you're going to accentuate, you're going to antagonize the cranial cruciate ligament and invite problems. Let's look at the horse. If you thought that was great, relatively smaller horse, but horse is fantastic. There we go. Horse is even bigger and more friendly. It's a BFF, bigger, fantastically friendly biceps femoris. It's attaching from the caudal sacral vertebrae and the sacrospinal or spinous ligament, which is in here. So all kinds of sacrum stuff. And then also sacrosciatic ligament, the lateral and middle patellar ligaments, and then again, the cranial border of the tibia, the crural fascia, and this tarsal tendon of the calcaneus. So it's even more important for everything stability, including the pelvis. And so what might happen? Somebody might say, oh, my horse's hamstrings are tight, especially the biceps femoris. Okay, what are some things we can do? We can do massage. There's a paper on massage and protraction of the limbs in horses. So we could work locally. We could do acupuncture. We can do some sacral points. So bladder 27, 28, 29, 30 in this region, or 31, 32, 33, 34, which is more what we teach with the human programs. And then around here are some bladder points, so maybe bladder 54. And then we have some bladder line points coming down here. We have bladder 38, 39, and then 40 in the popliteal fossa. And then we have, just about, it's probably more, just gallbladder 33, gallbladder 34, stomach 36, and so on. So we could do some real local treatment. We could include laser. We could probably can't have the horse dance backwards like we would for the dog, but anyway, there are things we can do. But is that sufficient? Possibly not. Possibly there's something going on with how the horse is being asked to move, restricted from moving, that is actually causing pelvic restriction, so lack of motion in through here. Maybe they're overcompensating by having to, when they advance a step, that they're having to overextend the stifle and strain the hock and all. So as always, we need to really evaluate the whole horse and everything about the horse, and think about what other contributing aspects, like why is that hamstring tight? It also, are the quads not firing? The quads are going to be antagonists in part to the hamstrings and the biceps femoris. What else are we looking at? Because the function of the biceps femoris is to extend the hip and extend the stifle, and this caudal branch here is going to plantar flex the hock, so coming down, and so what would be an antagonist to extending the hip and stifle, especially the hip? Well, we have the psoas also, which is going to be a big flexor of the hip. So there's so many things that could contribute to this problem, but the first thing is to identify it. The first thing is to palpate and understand from a whole horse perspective, whole dog perspective, etc., what is the issue, and we can do a how to see a dog or horse and watch, movement back and forth, and so excursion. Think about stability, be palpating them. If we're doing rehab, then we can do girth measurements of both sides and compare. And so there's all that we would teach you in one of our programs, because we're so heavily invested in anatomy and palpation. So just wrapping up and thinking about what to do for this muscle that will just keep on shortening when chronically stressed, then again, what can we do we talked about massage, but it wouldn't be just here. We want to think about the whole back and agonist antagonist relationships. What else is going to happen if the hamstring is having a problem? If the limb is having a problem, they're going to push their weight forward. We're going to have to check out the neck and the thoracic limbs. As I mentioned, dancing or walking backwards or dancing, you can try that yourself. And so walk backwards a little bit, and you can feel your own hamstrings, and are they working? Are they firing? And that's another aspect of biceps femoris rehab, especially for people, is that we have visual and verbal cues. It's like, okay, I'm intentionally going to activate my hamstrings. I can feel them for myself. The PT or whoever's helping me can make sure that they're firing adequately. And that is going to help reinforce the neural connection to your back, your legs, because so much of what is happening with the muscles is from the nervous system, so brain and spinal cord. So with acupuncture, massage, laser therapy, everything, we're also addressing the nervous system. So the whole nervous system, whole myofascia, whole animal, and make sure they're relaxed and that you're not scaring them during treatment. So, we just want to partner and perform our acupuncture without fear, and just the gentle way that we teach at Curacore Vet. So if you want to be notified about future Facebook Lives and YouTube Lives, make sure you subscribe and feel free to press that you like it if you like it. And pretty soon we're going to look at the pes anserinus and how that fits in with all these other muscles. If you have any questions, then write to us at info at Curacore Vet. So go ahead and find your small animal and compare the quads and the hamstrings and feel the biceps femoris. Sacrotuberous ligament, ischial tuberosity coming down, lateral patellar region, cranial border of the tibia, and that lateral aspect of the calcaneal tract, which will also be another topic in the future. Okay, but next week, or 2 weeks, next time, the scared yet sacred pes anserine. And the goose whose foot it is says, "You want to do what?" We'll talk about that. Thanks, everyone.